Well, the main goal is to really educate students on the differences that veterans' health can pose for them. And it's not just run-of-the-mill healthcare, but they've gone through a lot more experiences, including their combat experiences and any other military experiences they have, which gives them a whole new dynamic to their healthcare.
These are the natural results of being in the unnatural situation of combat. Anybody that's been in a combat environment is going to have some level of the spectrum of symptoms. And the longer you're there, sooner or later, anybody can get this. It doesn't mean you're crazy. It doesn't mean you're broken. It doesn't mean that these symptoms can't be improved.
Later on down in life, I realized, that I had PTSD, but I had no idea I had PTSD. I was just acting normal in a weird situation where other people would be like, you're acting weird in a normal situation,
There are about 24% of the females that we screen at the VA report they've experienced MST. So that's about 1 in 4. And about 1% of the males. So you have to think about this is just those who are enrolled in the VA and those who respond positively to the MST screening question. So as in civilian sexual trauma, MST is also a very underreported offense.
Yeah, you're going to have some difficulties. Okay, we understood that. What do we do about it? There just wasn't enough for us to get through it. You're going to have some communications problems. You're going to find it difficult to get along with other people because your mindset's a little different from everyone else's, understandably so, because there's not so much of a threat where we are here as an environment we just came from.
That was the hardest thing, was to seek help, because we were taught in the military to drive on, shoot first, ask questions later, that's how it was.
A doctor that literally sat in his chair in his office and said, "What do you want?" That was it. He did not listen. But we need you guys to be patient and listen. That, to me, is the biggest part.
It makes it a lot more gratifying of an experience if you can really relate to your patients, and that kind of goes across the line between civilian and military. If you can relate to your patients, you can better understand their problems.
I would just suggest to those of you that are going into the military, be true to yourself, pay attention to what's going on, and don't be afraid to talk to your peers.
It just makes me even more grateful to them for the sacrifices they've given up and the challenges that they face even after they come back from war. And it makes me want to do anything that I can to help them.
They heard me, they understand what I was going through. It wasn't the yes or no questions. I had people coming forward and asking why. So it has changed greatly.
We're so happy that the veterans could come, and as well as the VA physicians and staff. I think it made the world of difference to have the veterans here and be able to tell us their experiences firsthand. Here we have handmade lapel pins. So specifically they're American flags. The idea is to wear it on your white coat and kind of, always think about the military, think about your veterans, and think about the experiences they shared today.
Happy Veterans Day.
And happy Veterans Day
to everybody.